Hello, friends. Welcome to today's session of Biochemistry by Dr. Nilesh Chandra. Following our analysis of the INI-CET pattern over the last 10 exams, what we're going to do is very quickly we'll go through the recall questions that we have on record for these 10 papers. So, no detailed long discussions for these papers, just the question, what are the options, what is the correct answer, that's it. So, we quickly run through these 10 papers in the next 10 videos. After that, we had shortlisted 72 topics, out of which 60 were important and coming again and again. So we'll go through those 72 topics one by one in great detail. Whenever I pick up the topic, I'll tell you which questions were asked from that topic and in which year. Okay, so this part will cover with every topic we discuss, so that we have in perspective whether this topic was discussed a long time back and not very important, or this topic has been covered in the last 2, 3, or 4 papers and therefore more relevant. So those things will keep highlighting for every topic that we take up. But for now, the next 10 videos are going to go through the last 10 papers of the INI-CET. No great detail, only the question, answers, options, and the possible correct answer, starting with the latest one, that is the INI-CET May 2024. So let's go on to this. Okay. Okay. So first question, we had two possible recall questions based on ABG analysis. So I'll quickly go through the options that we had with us. So first one is the interpretation of following ABG values is, and you have the value of pH, sodium chloride, bicarbonate. Your options are high anion gap metabolic acidosis, normal anion gap metabolic acidosis, high anion gap metabolic alkalosis, and normal anion gap metabolic alkalosis. Okay. So first thing to note here is that the pH is 7.34. So this means that alkalosis is out. Two options are already gone. Now we are looking at acidosis. Now the reason for acidosis can be one of the two. If it is respiratory in nature, then the PCO2 value would be higher. PCO2 value is not given here. If it is metabolic in nature, then the bicarbonate values will be lower. So we have this option metabolic acidosis. So option A and B are possible. Second part is anion gap. So for anion gap, the formula is sodium minus sum of chloride and bicarbonate. So sodium is given here 135, chloride is 93, bicarbonate is 20. So 90 plus 93 plus 20 is 113. When you remove it from 135, so that's roughly 22 units. Normal anion gap should be 8 if you only take sodium, 12 if you include potassium also. So this is way away from the normal anion gap. So we're looking at high anion gap metabolic acidosis. So answer to this question is high anion gap metabolic acidosis. Very frequently when you get the questions like this, so this particular graph is pretty much useful. We'll discuss this when you're looking at the acid-base disorders topic. And sometimes we can get this chart in the question. This is the Davenport diagram. It is very easy tool for quick identification of simple acid-base disorders. Again, we'll mention this again when we're talking about acid-base disorders, when we're discussing the topics. Okay. So that was one iteration of acid-base disorders. The second iteration was like this: interpretation of following ABG values: pH 7.4, PCO2 50 millimeter mercury, bicarbonate is 30 milligram per liter. So 7.5 means alkalosis. So acidosis are out. In alkalosis, either the PCO2 value should be less or bicarbonate should be more. PCO2 is more, it is not less. So respiratory, no. Bicarbonate value more, yes. Metabolic. So we're looking at metabolic alkalosis. So we'll discuss how to approach the acid-base disorders when we take up the topic of acid-base imbalance and the acid-base homeostasis. Okay, I'm not going to details here. Just remember, for this question, the answer is metabolic alkalosis. Okay, so you have this question. Korsakoff psychosis, true is all except. So here your options are amnesia, confabulation, ophthalmoplegia, neuropathy. Okay, and let's look at the options 1, 2, and 3. Amnesia, okay. Confabulation, okay. Ophthalmoplegia, okay. Looks to be correct. 2, 3, 4. Confabulation, ophthalmoplegia, neuropathy, okay, see, the neuropathy is not a characteristic feature of Korsakoff psychosis. 1, 2, and 3 is still correct. Amnesia and ophthalmoplegia. Paraplegia is more a feature of Wernicke's encephalopathy, not of the psychosis. In psychosis part, the two main important components are amnesia and confabulation. Okay, amnesia and confabulation would be the more correct options. So the best, you cannot leave out. You cannot, if you look at option one, two, B, two, three, four, you cannot leave out amnesia. You cannot leave out the confabulation. So best answer should be one, two, and three. Amnesia, confabulation, ophthalmoplegia. So trick to understand here is that personal psychosis is the late sequelae of Wernicke encephalopathy. So the features of Wernicke will definitely be there. Okay. What are the features of Wernicke? You remember the Goa part that you remember? Uh, it is the global confusion, ophthalmoplegia, and ataxia. Okay, these are three features of Wernicke's. Oh, superimposed on that is the psychosis. In psychosis, you have the amnesia, and along with that, you have the confabulation part, which is coming in. Okay, so the amnesia confabulation must be there. Along with that, you can have the features of Wernicke. So option A appears to be correct. We'll discuss the B1 deficiency in much greater detail, where we'll also talk about the very part, how the clinical cases are coming, how they've been asked in the last 2-3 years. Okay. Next question. Congenital lactic acidosis is due to the defect of. Now, congenital lactic acidosis due to problem in the complex pyruvate dehydrogenase complex where the enzyme pyruvate dehydrogenase is missing. So option D is the correct answer here. The pyruvate dehydrogenase deficiency is responsible for congenital lactic acidosis. Lactic acidosis is an important topic where we see how the different factors are affecting the pyruvate dehydrogenase complex. In this case, we are looking at the inherited deficiency of pyruvate dehydrogenase. In folate deficiency, the true statement is your options are low homocysteine and high methylmalonic acid. Hemolytic anemia is a feature. B12 supplementation is recommended along with folate. Purine and pyrimidine synthesis are affected. Look at the options. In folate deficiency, homocysteine level will be high, methylmalonic acid level will be normal. Hemolytic anemia is not a feature. B12 supplementation is recommended along with folate is correct. Only the pyrimidine synthesis. Okay. Purine pyrimidine synthesis affected is also correct. Hemolytic anemia may be there, but first option is definitely wrong. B is wrong. B12 supplementation recommended along with folate is okay. Purine pyrimidine synthesis. So here we are more focused on the pyrimidine synthesis rather than the purine synthesis. Uh, C and D both appear to be correct. The better answer among them would be C. C is the more correct answer, although C and D both are correct. So if these statements are correct as per the record, you have to choose one, then the answer would be C. Okay, this is a feature of megaloblastic anemia. We'll talk about megaloblastic anemia in detail when you're looking at the B9 and B12 deficiency and how to differentiate between the two. Match the following disorder with clinical feature or lab finding: Cory's disease, McArdle disease, Pompe's disease, von Gerke's disease. Options are branch structure in liver biopsy, accumulation of glycogen in lysosome, exercise intolerance, hypoglycemia with lactic acidosis. So Cory's should present with the branch structure in liver biopsy. That is correct. One should be matched with A. So we are looking at options C and D. In McArdle disease, there should be exercise intolerance. So two should be matched with C. Option C and D are still correct. In Pompe's, there's accumulation of glycogen in the lysosome. So three should be marked with B. This is the correct option D. Option D is the correct. Von Gerke's present with hypoglycemia with lactic acidosis. So option D is the correct. So what you do, you match one of the options and then you look at the possible option which is the correct, which is matching your uh, possibilities and then go on from there. So we first eliminated option 1 and 2, we're left with 3 and 4. Then we subsequently moved with 3 and 4 and decided that option D is the correct answer. So 1 is correctly matched, 4 is correctly matched, 2 should be matched with exercise intolerance, Pompe should be matched with accumulation of glycogen in the lysosome. This is the correct match. We'll discuss the glycogen storage disorder. Very important topic. Very frequently asked, particularly in the NEET PG exam. In INI-CET, we recently have seen lesser number of questions from glycogen storage disorders. I think three in the last 3-4 years. So it is being asked, but less frequently in comparison to the NEET PG exam. In NEET PG exam, you definitely have a question from glycogen storage disorder. Inhibitor A and B are So inhibitor A, you can see here, no inhibitor is the blue line, red is the with inhibitor where the Vmax is common. Vmax is common with the normal reaction in case of competitive. So option A should be competitive, and in inhibitor B, you see the Km is common. Km remains the same in non-competitive. So option A should be the correct answer. Inhibitor A is a competitive inhibition. Inhibitor B is non-competitive inhibition. Inhibition as shown in graph. Again, very, very important topic. We'll discuss this, how to quickly identify which type of inhibition is being presented in which graph when we talk about enzyme inhibition later as a topic. This is one of the fairly frequently repeated topic, very, very important for all the exams. That is the NEET, PG, INI-CET, FMG exam, everywhere you get questions in the graph showing the inhibition. So we'll take a look at this graph, how to quickly identify each one of them later when we take up the topic. Which gene defect causes the familial hypercholesterolemia? So, hypercholesterolemia is due to the LDL receptor defect. LDL receptor defect is responsible for the familial hypercholesterolemia. We'll later on talk about the hypercholesterolemias, where type 1 and type 2A are the most important, most frequently asked in the exam. So we'll focus on these two primarily when we're discussing the hyperlipoproteinemias. Which of the following is not an amino acid derivative? Your options are histamine, serotonin, GABA, and creatine. Now, this is a slightly tricky set of options. Why? Because all of them are obtained from amino acids. They are not obtained by the process of translation. However, what you have to keep in mind that histamine coming from histidine, serotonin coming from tryptophan, GABA coming from glutamate, are obtained directly from an amino acid. But for the synthesis of creatine, three different amino acids would come together in a series of enzymatic reactions whereby the final product creatine is formed. So out of these options, I would select creatine, which is not an amino acid derivative. It is a special product of amino acids, so not coming through translation, but not a single amino acid derivative. Okay, so we'll talk about these special products, from where they're coming, which amino acids contributing to the synthesis of which molecules. As you can see here, arginine, glycine, and methionine, all of them together contribute to the synthesis of creatine. So we look at this detail of the amino acid and the contribution to the different synthesis when we take up the special products in our discussion. One of the again commonly repeated questions, and we frequently get this type of thing in your exam. Which of the following is not associated with a post-transcription modification? Your options are methylation, endonuclease cleavage, 5' capping, glycosylation. So here the answer is glycosylation. Glycosylation is a change which is seen in the proteins. So it is a post-translational modification, not a post-transcriptional modification. We'll talk about the post-translation modifications and the post-transcriptional modifications in our topic discussion later on. Which type of mutation results in the reversal to the wild type of phenotype when the mutant gene is suppressed? Now, frame shift mutation of coding gene, it will not help. Addition of another normal gene, unlikely to help. Deletion of the mutant gene is unlikely to help. So the answer is mutation of tRNA, so that it will not read, or it will incorrectly read the mutant gene. In this way, the mutation effect will be suppressed. So mutation of tRNA should be the best answer among the given options. Now, this is a very important knowledge information that you should know. Which diagnostic tool is preferred for metabolic disease screening in children? Your options are tandem mass spectrometry, uh, complete blood count, urinalysis, and genetic testing. So, when you're talking about screening, you want a tool which is able to identify maximum number of disorders and with high sensitivity. So, among the given options, the tandem mass spectrometry is the one which is used with a single dried blood draw. You can identify more than 50 different metabolic disorders in the children. Depending on what are the availabilities and options to you, you can choose how many to screen. In large number of states in the United States of America, up to 40 disorders can be identified with a single uh, dried blood drop. In India, some states have rolled out the testing facility for up to six, particularly in state of Delhi. Others are still contemplating, and a national program running at the level of Ministry of Health is looking at the possibility of rolling out the metabolic disease screening in all the newborns, but it is still in the planning stage, not yet implemented. So here the answer is tandem mass spectrometry. Now we come to fish. Fluorescent in situ hybridization is used to detect all of the following except your options are translocation, amplification, deletion, and point mutation. See, fish will be able to identify translocation, amplification, and deletion, which are bigger changes. Point mutation is difficult for fish to identify where a single nucleotide has been changed because the rest of it will be intact. It will allow for hybridization of the probe. So the fish probe will still get attached even if there is a point mutation. So fish is not very particular in its ability to identify the point mutation, but the rest of them is easy to identify using the fluorescent in situ hybridization, which is not a product of heme catabolism. Ferric iron, aminolevulinic acid, biliverdin, carbon monoxide. Aminolevulinic acid is the product of first reaction in heme synthesis, not in the heme breakdown. In heme breakdown, we get the ferric iron, biliverdin, and carbon monoxide. Biliverdin is subsequently converted to the bilirubin. So here your answer is aminolevulinic acid. So these were the recall questions that we have from INI-CET May 2024. Please watch out for the next video looking at the next INI-CET paper in series. We only look at the questions and the answers. Topics we'll discuss together for all the INI-CET at one go. Thank you very much. And that's all for now from here.